Morning again, all. Well, we are all energized, right? Because there's just so much happening today that I think, I don't know what we're going to do with all of this information, but we are really, really happy for this, in particular because it speaks to both social and community development. And so, we waste no more time in wanting to introduce to you. We are supposed to have four presenters today. One of our presenters, Dr. Kadamawi Naif, however, is abroad, and we're hoping that he can be beamed in with his presentation. So let's hope that we can connect, but you know how this technology stuff is. Sometimes it works, sometimes it does not work. So we're hoping that he will be here. He's the second presenter. Our first presenter today is Dr. Olivene Burke. Dr. Olivene Burke is the Executive Director of the Mona Social Services at the University of the West Indies. Her specialization is in transformational leadership and human resource management. And Dr. Burke has done a lot of work, at least 13 years of work with volatile communities in Jamaica. And so we look forward to hear what she has to say about defining this. We must begin, as our speaker before said, with defining best practice. This is going to provide the overall framework and guideline to where we go from here. Okay, so we start at the beginning by defining best practice. Dr. Burke?
Good morning, everyone. Okay, kind of lukewarm, like you're not fed up, but I'm hoping that by the time we get into this some more, we will feel a little warmer. My task is to bring to you today our perspective on best practices. And the perspectives were pulled together by a team of persons from three universities, the University of the West Indies, the Northern Caribbean University, and University of Technology, and also some community development specialists from CSJP, JSIF, NHD, PIOJ, and the Social Development Commission. Now, the team has been working over a period of time, and we have taken to you our perspective on the definitions in 5 areas. And the following areas that we have considered the broader theme of best practices under are community readiness for assessment, community readiness, the pre-assessment, collaboration and partnership, use of data monitoring and evaluation, sustainability, and evidence of impact. Now, these are terms that you have been hearing repeated from the speakers since morning. An individual presentation will also be made by Naif on the last point, evidence of impact. Hopefully, it will come through. However, in terms of community readiness and assessment, it is defined as the extent to which a community is adequately prepared to implement a development intervention or program, and that definition was taken by Pruitt 2006. Or the degree to which a community believes that a change is needed, feasible, and also desirable. It is also defined as the extent to which a community is prepared to take action on issues in pursuit of its development. These definitions we agreed on that could be the possible working definition for community readiness. But a best practice considers the generally accepted approach utilized to ensure efficient and effective outcome. And for a best practice to be utilized in working with communities, an examination of the readiness for action is necessary. Community readiness involves an awareness of the issues, community motivated to get involved. Community has to buy in the intervention plan. The community members' social and psychological ties to the community is essential because that is what will ensure that they buy in, that they are a part of the process. The ability of the community to understand an issue or the problem, they have to clearly understand it in order that they can voice it, in order that they can work with whomever the partners will be to effect the solution. There also has to be an identification of the leadership, local leadership, and their capacity to undertake the developmental work. Importantly, there has to be evidence of good governance structure with rules, accountability, participation of members, as well as their ability to articulate their goals and objectives. Now, there are many issues readiness issues that are important in addition to these. Another important one I want to point out is the evidence of the local and external resources. Because again, we have been hearing repeatedly the importance of the resources in carrying forward any kind of solutions that have been identified. And finally, on the readiness aspect, is the community's knowledge of the ecological environment and pursuit of sustainable economic livelihood. Far too often we hear, and we have been hearing reported in recent times, the inability or the discontinuation of programs once, especially funding partners, have concluded their time in organizations. What we are saying is communities, there has to be that sustainable economic livelihood, that sustainable direction, that sustainable project. In terms of collaboration and partnership, the definition that we are working with is that it is a give and take relationship that can strengthen organizations' capacity to long-term cooperation and collaboration. And the important question in collaboration is that it identifies the gaps, it provides an indication of previous attempts and solutions, and it also provides the opportunity to combine human, financial, and other resources. Then in terms of strategies and approach to partnership and collaboration, we're talking about established or engaged state bodies, CBOs, CDCs, community-based organizations, civil societies, NGOs, foundations, international funding agencies, tertiary institutions, competencies. The point I'm making is it takes a broad cross-section of institutions, persons, agencies, funders to move forward in terms of the lessons, best practices on collaboration. Then in terms of sustainability in best practice, for most organizations and agencies that aim to assist in the development of communities through various initiatives and programs, sustainability is a targeted goal all hope to achieve, especially because the purpose is to have long-term impact. Now, there are various definitions of sustainability and sustainable development, which are mostly similar. What should be key, however, where sustainability and community development is concerned are longevity and benefits for future generation. The other area that we looked at to bring together a definition for best practice is the importance of data usage. And the definition that we agreed on is, according to a researcher, it's a data-driven decision-making that pertains to systematic collection, analysis, examination, and interpretation of data to inform practice and policy. Importantly, it should be noted that the data gathering and usage should be ongoing, and it should be a part of an ongoing cycle of instructional and program involvement. And the data should also be relevant. We should be going back to the data from time to time in order to see where we are and where we need to go. Then we move on to the other point, which is monitoring and evaluation of best practices. And this has been defined as an intervention, that an intervention may be regarded as a best practice if it is underpinned by a robust monitoring and evaluation system. As a critical pillar for the management of development results, M&E, monitoring and evaluation, is the only function that provides information on the performance and impact of an intervention. So by providing this mechanism, managers, funders, decision makers, policy makers are able to track, report on, and evaluate progress towards expected results, as well as this will provide them with the opportunity to link the findings to improvements in operations, program design, as well as implementation. As quoted by the PIOJ DG from Lewis Carroll's Alice in Wonderland, if we don't know where we are going, any road will take us there. In this regard, why leave development to chance? Point we're making is it is important that we bear in mind the 5 pillars in terms of the lessons learned and the definitions that we are using to define best practices in community engagement. We should now be bringing in NIFE, who should have been bringing in NIFE, who would be talking about the social returns and investment, but in his absence, I will just mention that the social, we have been hearing again that we have not been getting enough in terms of the measurement of the social returns on investment. And NIFE contends that social investment are not necessarily made to create money, but to create value. And that value has to be calculated in terms of a tool that is designed to ascertain the social, environmental, or cultural values that has been created for different stakeholders. And according to NIFE, the social return on investment tool will express social value in monetary terms, monetarizing it. Monetarizing allows a relative impact assessment to be made as it goes beyond the use of output to assess social results. Now, in terms of the function of the social return on investment, the tool will be used for the purposes of, he says, valuation and monitoring. Valuation of the social return on investment will assess the success of the social investments and will answer the following questions. What is the expected social value, and just how big the return or will the return be? In evaluating the social investment on return, it is important, NIFE says, to identify indicators that make the impact of your social intervention enterprise measurable. This is a crucial part of the social return on investment analysis, as it required for monetarization and the overall calculation of the social return on investment. At some point, we will try to bring NIFE in again to demonstrate or to illustrate how he calculates the social return on investment, because based on the fact that we have really not been putting a money value to the extent that if you were able to train 500, 800 parents in a given time, and those parents have been, their mindset have been changed so much so that they can relate to their children and other persons in the community better. And progressively, how that impacts other persons and the next generation, we have not been calculating it. And that's what NIFE is putting a figure to, so that we really understand the social impact, the social returns on investment. With that, I turn back over to our chair.
Thank you for that, Dr. Burke. I'm still not sure whether Dr. Knife will be joining us, but we're still trying. But just to mention that Dr. Kadamawi Knife, his specialization is sustainable development, and he lectures at the Mona School of Business, where he's also a researcher, and he's also the director of the Center for Entrepreneurship and Thinking Practices. So we are so sorry we couldn't reach him today, but I am sure that we have his presentation that we can also share with you, because it's an important area to go into. We're always calculating economic costs. It's time now to calculate the social cost. So we really look forward to that. We have a third presenter, Ms. Peisha, I love to say Keisha, but it is Peisha, Ms. Peisha Bryan Lee, and she's a program director for Vision 2030 Jamaica Secretariat at the Planning Institute on Jamaica, and she informs me that she emphasizes a lot in her work on the coordination and planning of the implementation of Vision 2030. So, Ms. Peisha Bryan Lee.
Good morning. Today I'll be speaking briefly on Vision 2030 Jamaica as a best practice. Now I know we're looking at community-based development and best practice within that context, and it's oftentimes difficult to align the national with the local level. And so, in speaking of Vision 2030 Jamaica as a best practice, I ask that you bear with me while I speak about it in terms of it being a national development plan best practice, and then how we can look at it in terms of the localization process. So I'll briefly examine the identification of some of the main criteria for a national development plan to be determined to be a best practice based on literature and current development practice. I'll also be looking at the tenets of Vision 2030 Jamaica that meet that criteria for best practice as a national development plan. What makes a national development plan a best practice at the community level, and Vision 2030 Jamaica's performance in such regard. When I stepped in today, a nice gentleman from Augustown stopped me and he said, I want to speak to you about Vision 2030 Jamaica because I don't feel it resonating at the community level. So I think that is something that we should also speak about today. So Vision 2030 Jamaica comprises our vision and goals for development, and it also has a roadmap. So it doesn't just say, here are aspirations, it also includes a roadmap to get there. This roadmap was not developed in isolation in terms of the PIOJ sitting in an office, and it wasn't developed just by development planners. It was developed through consultation with stakeholders, and we are confident that it reflects the goals and aspirations of the Jamaican people, and also tangible and realistic approaches to get to our development goals. So it is our first long-term national development plan. It covers a 21-year period. anthem, the anthem came up. You know, the anthem says, give us vision lest we perish. So the anthem is strengthening my stance. So, all right, so I know, and this is one of the things that comes up often when we start talking about Vision 2030 Jamaica. It came into being in 2009 to give us a path to reach developed country status by 2030. And oftentimes when we say that, that is where the room goes up. Can we become a developed country by 2030? But the plan process is not just about the goals. It is about the process to get there as well. So the realization of Vision 2030 Jamaica is everybody's responsibility. Not just the planners, not just me standing up here, it's everybody's responsibility, and we'll speak about that a little later. We should also take note that Vision 2030 Jamaica speaks to development Jamaican style, which means that in 2030, we don't want to look like the cities in Europe or America without having the authentic Jamaican culture. And even we have had sessions with young persons, and we tell them to dramatize 2030. 2030 has the ackee and saltfish, the dancehall, the reggae, but it has good health, good education, persons feel included. We have clean streets, for example. They looked at things like the environment. They spoke about having sustainable income, but they wanted that within the context of their sweet, sweet Jamaica. So Vision 2030 Jamaica has 4 goals, 4 synergistic goals, and they are interdependent, and they cover the social, economic, and environmental dimensions of sustainability, and there are 15 related national outcomes underpinned by good governance. I will not go into the development results on the basis that, based on the interest of time, and that can be shared, and I'm sure most persons have heard them repeatedly. And we know the vision statement is Jamaica the place of choice to live, work, raise families, and do business. You know, I should tell you that our communication specialist sent me a clipping from a European leader speaking about wanting their country to be the place of choice to live, work, raise families, and do business. Yes. So, I think just to say the other parts of it, I think are imbued. All right, so approximately 134 countries had national development plans in 2018, and that moved from 62 in 2006, 80% of the world currently live in countries with national development plans. The global thrust towards results-based management, and we know that results-based management means that we're not focusing on activities, we're focusing on knowing when our dollars are spent, our hard-earned taxpayer dollars are spent, that they produce the results, the changes that we want in our lifestyles. So we don't want to just engage in activities, we want them to be meaningful in terms of how we experience development. So that global thrust towards evidence-based development and results-based management that really was pushed during the Millennium Development Goals has really pushed how we look at national development planning in terms of a best practice within that context. The development of the post-2015 development and the development agenda and the Sustainable Development Goals has for many revolutionized how we look at national development and has very much shaped what we consider to be best practice. And for those countries that had national development plans, like Jamaica, when the SDGs came into place, we're now being considered by some to be gurus. We are consulted in terms of how do you develop a national development plan that speaks to sustainability and inclusion, leaving no one behind. And it has helped us to work together better regionally and as a global community. So with greater focus on national development planning, the criteria for best practice has shifted from just the results to the process. And I say that because oftentimes when we speak about development, planning and about national development, what gets us ticked up? What gets us really energized? Is it the process or am I feeling the results? And oftentimes we forget about the process and we ignore the process because we want to see the results today. I met with some high school students who said to me, Miss, Jamaica could be a developed country next year if you adults took it seriously. But they were not thinking about the process. But that's okay for children because they think in the immediate. But we have to consider process. Okay, so when we think of Vision 2030 Jamaica in terms of best practice, I will list some of the areas that we have been identified as a best practice. We have been identified as a best practice when it comes to having political leadership at the highest level driving your national development. Because if your government doesn't own your development plan, your plan does not become a reality. We have bipartisan support for our plan. Our plan commenced development under one party, it was tabled in Parliament and completed by the other party, and we have had continuous implementation of Vision 2030 Jamaica under different political administrations. That is a best practice. And I say so because a lot of countries, we would be surprised, don't have that. But this also speaks to sustainability. You can't have a sustainability in your planning if every 5 years you change it. So the fact that political leadership embraces the plan also facilitates sustainability in how you approach your plan implementation. It also facilitates us looking at inclusion in a tangible way. You don't include everybody if you don't include leadership. And here we go beyond political leadership. Our CDCs, our PDCs, our citizen associations, or various levels of leadership have to be involved in the national development process to ensure that it's sustainable and that it is inclusive. But we acknowledge you cannot be involved at the local level if you don't know what you should be aligning yourself to. And I say that because we have been looking at community level development and at parish level development, and we've been discussing it with our stakeholders, and a lot of our stakeholders say when we look at your plan, it is high up there, it is way up there. How does this affect me on the ground? And so one of the things we've been looking at is how we can address that. Now we recognize that that has to do with best practice at the local level. And I'll speak a little later in terms of at the end of my presentation to that. We do have a framework for implementation. Again, that is a best practice. Jamaicans have always complained traditionally that we come up with these grandiose plans, but we don't implement them, and we don't have a process for implementation. We have a framework for implementing Vision 2030 Jamaica, a framework that actually we've been consulted on from other stakeholders. We've been asked, and I say stakeholders, I don't mean persons in Jamaica. I mean regionally and internationally, we have been asked about this document. Can you share it with us? Can you share your process with us? And we are told that we are a best practice. When it comes to monitoring and evaluation, having a framework in place, whilst we are working to strengthen that framework, we are still considered a best practice. We monitor our development results through indicators, and we report on these to the public. So we do know where we are in terms of our development towards our goals. Now I can tell you, up to September, our data said we had improved in 64% of our indicators. 32% met the target, another 32% improved above the starting point, but we had not met the targets, and another 28% had not improved any at all since 2007 baseline. But the fact is, we measure that, and that is a best practice. I will pause there to say, though, whilst we are evidence-driven and we do have an M&E framework, being a best practice does not mean that your process is perfect. Being a best practice also means that you have systems in place to assess and to be real about your imperfections. So Vision 2030 Jamaica also has included a framework for continuous improvement. We continuously assess not just progress, but how we are doing, going about the business of implementing Vision 2030 Jamaica to ensure that we are doing the best we can in terms of prioritizing, in terms of allocating our resources, and engaging our stakeholders. Again, the implementation of vision, the prioritization, all of that is driven by stakeholders. And I also point out, for example, one gap that we have. It was mentioned earlier, speaking about impact. Now, we monitor very well in Jamaica. So we monitor the indicators, and we can tell you year by year the data says X. Where we have a challenge is we cannot, for quite a number of areas, tell you empirically if the approach we're taking is the correct approach. And that's because we insufficiently engage evaluation. Now, we know that because we do an assessment of where our gaps are. So the whole idea of impact at the national level and the community level is critical in ensuring that the best practice moves from being a best practice on paper that says that here is the approach we should take to development, here is what we should do, here are our goals, to, in the end, allowing us to achieve those goals that we have set for ourselves. Because whilst we know a best practice should not be perfect, in the end, how we will be judged by the citizens of this country is not just by the process, but by the outcomes. In 2030, and even before 2030, has my life changed for the better? And has my life changed in accordance with these goals? Now, my time is up, so I want to thank you very much for your time. But I hope you have a little better understanding of where Vision 2030 Jamaica sits in terms of as a best practice. And just to note that we are currently going around the island trying to engage our stakeholders at the local level so that we can develop a stronger program for engaging you so that the next time when we speak, we can say that we are a best practice for localizing national development and allowing you to be able to see in your own parish, in your own community, how you can engage the process and how the process is affecting you. Thank you very much.
Okay, thank you, Ms. Bryan Lee. I was taken by the comment by the community person who said that they felt it was very far away from them. They're not seeing Vision 2030. So I'm happy that you are now, that is also part of your monitoring and evaluation for improvement, But I'm usually listening a lot to community people myself. So when certain things are said, it is very important that we address that. Because especially as we speak of local, what is it? I think you spoke about it, Dr. Burke. She also spoke to local resources. I speak to local assets. We always want to talk about needs and so on, but we never look at what are your resources and your assets in all of this, because it is, as we have been saying so far, that we engage in partnerships. And partnerships doesn't mean, it means empowerment and giving and we're going to collaborate on all of this. What are you giving to all of this? Certainly if we want to ensure sustainability. Well, we have a presentation now from our guest speaker. I know he has been introduced already, but I just would like to remind you all that we look forward to hearing now from Professor Emeritus Irvin Waller, who works out of the Department of Criminology at the University of Ottawa. And his specialized field is criminology, crime prevention, and victim rights. And I'm just telling a little bit about victim rights because he was instrumental in advocating to the UN for victim rights and to be recognized. And so I don't know if that was said before, but I picked that up in his bio, and I just thought I'd share that with you. And of course, he has done a lot of work, a lot of writing. I think we need to purchase his reading. I really need to get some more on it so we can share that with you, so we can look further at what he has had to offer. But we're really interested now in this presentation because Jamaica's situation now of crime and violence certainly calls for us giving support and recognition to those who have worked successfully in this area, because ending violent crime in Jamaica is where we really would like to see, as he says, by 2030 a 50% reduction. And so we look forward now to what are the proven solutions? How have they been implemented successfully? Which Professor Waller is now going to tell us about. Thank you.
Right, so you got to listen to me again. So, you've heard the title. I'm basically going to address the issue of the definition of best practices by examples of what gets results. And what gets results are actions that can be achieved within a 2 to 3 year period, providing you've done the training and the planning before that. You don't have to wait forever. So it's going to focus on two of the issues that I addressed earlier, cost-effective, effective solutions. And I think cost-effective is extraordinarily important in terms of convincing governments to pay for these things. But ultimately, the real results are what is effective. So a 50% reduction. And I'm going to talk about the essentials and give you some examples of those. So it builds on the book that I've already talked about the solid science of violence prevention, those 7 essentials, and how we get buy-in. So earlier I showed you this slide. The reality is that we have solid knowledge about what delivers results. The problem is that almost nobody is using these. Nobody is using these. But they are important, and these are, of course, portals. But in my book, I've used also commissions that have looked at violence prevention in different countries, looked at the causes, looked at what their conclusions are. So it's not just based on these portals, but it's undoubtedly solid. I want to repeat the word solid. There is no excuse for not using this knowledge. So what does it tell us? It tells us that some policing actions have been effective. So focused deterrence is the fashionable one at the moment. If you're following US media, for instance, Senator Booker, who's running to be a Democratic presidential candidate, has just introduced legislation in the Senate and the House of Representatives to break the cycle of urban gun violence. And I think the contents of what he's put in there are relevant to you here. And one of those, he has 3 items in there, and he also has some cities, which I'll talk about in a moment. One of those is focused deterrence. What is focused deterrence? Well, the police claim they know who's involved in gangs, and you basically invite them to come to a central location where you read the Riot Act. You say, we're going to be tough on you, and at the same time, you bring their mothers or the community who says, we're fed up with all these shootings, and we want you to change. And you also have, off to the left, outreach workers. But what you're doing through the police action is pushing them towards the services that can work. And if they don't go for those services, then you use the old methods. Hotspot policing is unfortunately become the main thing that police do all over the world. They use data to analyze where you've got a hotspot, and they try and tackle it. And they get a bit surprised that 2 years later, this hotspot's still a hotspot, and 4 years later, and 6 years later, etc. I'm not against hotspots, but if that's your only action, you're not going to go a lot of places. They also talk about situational crime prevention, but, you know, covering the country with closed-circuit television, which is one of the classics, is not actually going to do a lot for violence. It may do a lot for property crime. One of the things that's often overlooked is diverting people out of the system. So the police respond to what's really a mental health problem or a drug problem. So instead of dealing with it as a police problem, you actually put them on the slip ramps, going back to mental health services and to drug addiction. Of course, you have to fund those other services, which people seem to overlook. We also know there are a series of social things that have worked. And in the previous slide, you would have noticed that in squares were the percentage reductions. Hey, 50% reduction is not even exciting for me. It is so obvious to do in terms of the solid violence prevention. But just to repeat this, so cure violence, Trinidad Tobago didn't actually achieve a 50%. I think it only got 47%, only 47%. In my view, they could have got better, but they were using cure violence, and 47% is pretty good. And if you're looking for community reaction as one of your results, cure violence should certainly be on your list. And if you're looking at funding from USAID, they fund cure violence outside the United States, but they don't fund it inside the United States, hence why you have cities like Chicago or Philadelphia. But cure violence certainly should be on your shopping list. My preferred one is actually the Youth Inclusion Program, which is a British program. And one of the most important things about it is it's a national program. And it was spread across the whole country. And when it succeeded, they started doing more of it. So it's a really interesting one to know about. I've already mentioned down at the bottom here hospital interventions, an obvious thing, but you have to have the youth outreach workers to do it. It gets huge reductions. You're basically reducing returns. I remember the public health doctor in Boston hospitals at the time of the Boston experiment saying, well, you know, the guy comes in with a gunshot wound, he's still alive, you sew him up, and you know that he's coming back. The only thing that you don't know is he coming back in a body bag, or is he coming back maimed? And this is an obvious solution. I could talk about the life skills stuff, becoming a man, that's the stuff to reduce toxic masculinity, and the Canadian Stop Now plan. Notice they're all 50%, 50%, 50%. It's kind of boring to see this. But it's not boring to see that so many countries have not acted on this. And the United States is amongst those countries that have not acted on it, and you are amongst the countries that have not acted on it. Some stuff on violence against women. We know a lot about how to reduce violence against women. The main things are in schools and in universities and colleges. And again, you see 50%, 50%. I can go on. Okay, so I showed you this summary slide before. I didn't emphasize this little scale over here. These things are incredibly cost effective. You have no reason for your funders, be they IDB, be they Canada, be they USAID, be they DFID, be they the World Bank, for not putting money into these things. These are really smart investments. Now, the contrary to smart investments is stupid investments, right? So if you want to see stupid investments, look at Chicago. Look at Philadelphia, but you better look quick, because Philadelphia is going to be one of the models that people will be following in the future, because they had a mayor who decided they wanted to have a smart action, and he developed a plan, analyzed the problems, started looking at what has worked. And by the way, his controller, who of course is a woman, went and looked at what were the impacts of violence and showed that the city could make money after paying for the violence prevention programs, because when you reduce violence in communities, house values go up. And in Philadelphia, taxes are based on house values. This is basic common sense. This is not Lewis Carroll. This is basic common sense. So, target. This is a target. And what you see here, the red is what you're good at. You spend lots of money on, maybe not enough, but you spend lots of money on reacting to the system. This is very expensive. Expensive in lives, expensive to your GDP. The yellow is getting people on the off-ramp. So police are dealing with problems that actually have nothing to do with crime, but they react because they're the emergency number. The green is the effort to try and change the world. And yes, there are SDGs about reducing poverty and so on that are great, but you will have difficulty achieving the violence goals by 2030 by only doing that. I didn't say don't do that. Infrastructure is really good, but IDB has a wonderful chapter. I encourage anybody from IDB and anybody not from IDB to read, which basically says the key is not arguing about more tough on crime or greater social structure, infrastructure. It's about this blue group. It's the blue group that is incredibly cost effective. So you have to know where to target, what are the risk factors. You have to use those things that are successful. I'm not going to spend time on this slide, but basically green are what you would do through social investment generally, and blue is what you do from targeted. That means you have to analyze. You have to know what the risk factors are. You have to use that solid science. You have to measure how you're implementing. You have to measure goals, and you will get 50% or better. So here are the 7 essentials again. I'm not going to talk about them, but here's an analysis of 9 cities on those 7. And I'm not even going to give you a lot of time here. But Bogota achieved a 50% reduction using those 7 essentials. And it's gone on keeping it coming down. Boston achieved it and then lost it. 10 years later, they had to reinvent it. Why did they lose it? No sustained funding. No sustained funding. Glasgow, it's down to 2 per 100,000. It used to be at 6. That is nothing by your standards, but their model is great. And their model was based on Bogota and Boston. Bogota is like you, or used to be. Boston was not quite as bad as you are, but Glasgow was built on that. So Glasgow was building from Latin America and from the US to do success. Chicago is a magnificent disaster. Ciudad Juarez, I'm going to show you. Stockton is a success story. And then you have some other success stories that are focused on alcohol. My impression is that alcohol is not as important here as it was in those cities. But you see very large reductions. So if you can get those large reductions in those cities, why not here? So this is, the black line is Bogota, and notice that once it came down, it stayed down. Recife is the gray line. It came down, they stopped doing it, it went up, they're now bringing it back down again. This is Ciudad Juarez, that was worse than you, maybe not worse than some of your cities. This is a city just below El Paso. El Paso has the lowest homicide rate in the US on an annual basis. And you see this coming down. How did they bring it down? They brought 5 national agencies who cooperated based on a plan. They implemented the plan, and they got these large reductions. And they've largely kept it down. You can do this here. You can do this here. This is Honduras that was mentioned by the IBD speaker. You see violence going up and coming down. By the way, it hasn't come down that much below yours. Most of the coming down is due to changing corruption in the police. How did they do that? They basically let a third of their police go, and they raised the standards. But if you're going to I should tell you that I live in a city of 1 million, and we hired the best police chief in the world, and he was born in Jamaica. So, and he's going to do the things that I've talked about here. He's already said he's going to, he can only do part of it, by the way, but he's going to do this. So you have to do more than the policing issue, but it shows you these huge reductions. Now, I could talk about other cities, but there are, I showed this slide earlier, So I'm going to keep going here. I've talked about this. I'm back to my 5 things. And so I want to keep it short. I'm waiting to be told to shut up, but I'm going to, I think I've covered the main things I need to say. So there is evidence, solid violence prevention, that you can be inspired by if you can get government and possibly private sector and international groups like the IBD. IBD talks, and they are giving some money, but they need to be putting their money much closer to where their mouth is, and the same is true of the World Bank, because both of them are preaching a message pretty similar to mine, but they're not putting enough money into this. And here are the 5 points. I think I've stated these points. But the main conclusion in terms of best practice, a previous speaker has talked about how you assess readiness. And I don't know, but it seems to me that a country that is amongst the top 5 in terms of epidemic levels of violence, that is enough to motivate that country to actually rethink what they're doing and to look at the transformations that are necessary to achieve the sorts of reductions that are being achieved elsewhere. And if you add to that the impact on GDP, then I think you have a very compelling case for getting funding, maybe from the private sector as well as government, as well as those international funders like my own government. But the speaker just before me talked about process. These are 5 process things that, in my view, are absolutely necessary and essential to achieve the sorts of reductions that I think you can achieve by 2025. Now, I'm not your prime minister. I would promise by 2030. But I think you can achieve these by 2025. But that does require increasing awareness. It's so wonderful that so many people are here who can hear about the things that we know have worked on a one-dimensional basis, that have seen the sorts of stuff that have worked in cities, not just in the north. By the way, there are 4 US cities amongst the 50 most violent cities in the world. So Baltimore has a higher homicide rate than Jamaica. So it's not just an issue of Jamaica. Train human talent, and that means about planning, and that means about selling, and that means about how to convince governments to invest. Those national plans that I've talked about, and using modern tools to help in those in the planning. When you talked about the development plan, I didn't hear you mention violence. For me, I'm a violence guy, and yes, I'm a violence guy because I'm about reducing the number of victims, and I'm sure that every community in Jamaica, I mean, the taxi driver, I said something about, he said, nobody's safe in Jamaica, and I'd read the Canadian government warnings before coming here, and apparently they agree with him. And this can be changed. And I'm sure that every community in Jamaica wants, I'm not sure what I did, every community in Jamaica wants to be safe, and I think we know how to get there, and I think it's a question of deciding that you want to get there. It's a question of acting now with those process things that I've identified that lead to real action in local communities, that you will achieve large reductions. 50%, in my view, is minimal in the homicide rate, and you can do the same if you can measure it in violence against women and violence against children. So thank you for listening once again.
Thank you, Professor Waller. Quite insightful here. Some of these things we have heard of, Some we are hearing really for the first time. But I was particularly taken by the strategies that he speaks of, you know. Some essentials, yes, but there are some strategies that can begin very early. Those partnerships he spoke of, partnerships between the police and the community, yeah, helping to resolve that. I mean, I know we have started some of that. I don't know the extent to which it is highly supported, because he also mentioned what is very important is a continuation of funding. We cannot fund today and not fund tomorrow. This is an ongoing situation that we are dealing with. So the ongoing funding, the involvement of youth, yeah, in youth decisions, right, and in whatever it is that they need in terms of training. Those are things. I like the idea of the family support, starting from the early stages of early childhood development and up. And so it's a continuation of all of these things, because new generations come about, you know, so it's something that we have to continue to support. I think I also heard of outreach. I think the outreach is also critical. I like the idea of the hospitals, because we really meet the victims at the hospitals. So whether it's a perpetrator that is a victim and perpetrator, we meet them right there. It's critical that we meet them there. And of course, on the street corners, yeah? So I think we have a lot to put together. I don't know how many persons are here that for us to now consider things like developing this committee of persons that he spoke of, you know. Well, all right, so we have question and answer now. We don't have a lot of time, but certainly we would like now to hear from you. Our presenters are here to respond. So what are some of the questions that you, burning questions, issues that you would like to, What are we going to do? We're going to use, oh, they're there. Oh, yes, sorry. Yes, I'm seeing the microphones, right? One here, one there. So we want to ask you to just come to those microphones. There are two of them in the two aisles. We don't have a lot of time. We have about 10 minutes, so we have a second session to go into. So we want to give this first session 10 minutes of questions. Yes? Where is there one? Okay.
I've noticed that some of our goals, though, are very big goals, extremely big. And especially at the community level, you have a problem explaining to the community persons what is it that we're actually doing, the goals that we want to accomplish. Because to the persons actually working on the ground, and I've worked for several organizations, the goals are big. And they forever be big, because at the World Bank and at the IDB, and this is no disrespect, they talk in hyperbole, very high goals, very high standards. We talk about 5%, 10% growth, and so on. But how does it come that down to breaking it down to the community persons and to the organizations on the ground, the CDCs, and community groups who want to accomplish these goals with the help of the government and IDB, World Bank, and the PIOJ? What programs are in place to actually keep breaking down these projects to smaller bits that people can actually digest and actually see how they fit into the picture of this greater national development?
I think the problem is actually the other way up. I think if you went into some of the communities, you probably live, I don't know, but if you go into the communities where you have high levels of violence, they know why they have high levels of violence, and they know the sorts of solutions. I'm always amazed by politicians who say that the only way they can stay in government is by paying for more tougher policing and tougher sentences. If you actually look at polls, you see that it's very different, and you see that people know that it has to do with parenting that's already been mentioned, it has to do with jobs, it has to do with failure in school, and it has to do with lack of hope. So I think the issue is how to get governments to come to grips with what is the evidence shows are the risk factors and causes, and what the evidence shows are the solutions. And if you set up something like a youth inclusion program or a cure violence, where you have a local community center with 2 people from that area or something like that area building trust, they have no difficulty in persuading the community that they're doing good. If you have policing that is building confidence, and that's not that easy to get, but if you have that sort of policing, then they begin to get more information. The impunity tends to go down. So I don't have difficulty in selling the sorts of stuff that I've talked about. You know, people pick up on this hospital thing because it's so obvious. And most of these solutions to people are obvious. The problem is getting this transformation in how governments across the world have been dealing with this. And the United States has of course dominated this with it's exporting its policing techniques and its incarceration stuff to other countries. And you see in Latin American countries now, it's in Costa Rica just 3 weeks ago, and you see the incarceration rate already at half that of per capita of the United States. This is crazy. And their homicide rate has doubled. And they're just not doing the things that are smart. And I like the IDB expression of smart, of being in between this tough on crime and this social stuff, smart spending. But you have to spend. And I think if you spend, you will actually get support. You talked about the government getting re-elected. I've worked for Mandela, who got elected on a tough on crime, tough on causes. I've worked for Blair, who worked on a tough on crime, tough on causes. This idea that the only way you can get elected, you have to look at Bogota, 3 different mayors, and they were doing it by reducing violence. I think politicians who go for reducing violence can get re-elected. I didn't say Bolsonaro didn't get elected, but he's a tough on crime guy. But you can be tough on causes provided you don't take away completely the tough on crime. You have to reduce impunity and you'll get elected. And I'm not a politician though.
I would want to add that perhaps one of the reasons why the goals seem so big is because of the fact that they are maybe not fully communicated to at the local level, so that everybody sees in a direct way their role in the bigger picture. So the move that Peisha just mentioned earlier in her presentation to educate some more at the local level, so that everybody sees their small part in the big picture, that could help reduce that perception that the goals are so big and unachievable.
Could I also add that I think oftentimes it's just the words. The words sound big, but it's the same thing that you're saying in communities. It's the truth. It sounds big. Sometimes the words are fancy, but it's the exact same thing you're saying. So when the goal is explained, or when you start interacting with the goal more, you realize the exact same thing you want in your community is the same thing the goal is saying. Oftentimes I think where we have a bigger challenge is the strategic part of it. Here are the approaches. Are you at the community level? Because one of the reasons why we have a national development plan is so that we move in one direction together. So that you're not I'm from St. Mary. So we're not in St. Mary doing something, using particular pesticides or whatever that's gonna go in the water and influence farming in Portland, for example. The idea of a national development plan is that it puts us all on the same page broadly. So I think oftentimes where we have to focus on is the approaches to ensure that we're all working together towards the same end. But in terms of the goals, I think we are pretty agreed on the goals when we sit and talk. And I just think it's important for us to have more conversations about what the goals mean.
Thank you for good presentations. And this question is not only for the presenter, but also for everybody to reflect on. We know why we must do it, violence prevention, or else we have to migrate. And we also know what to do. And when we come to symposiums like this, we understand the science behind it and more evidence-based interventions, which have been successful elsewhere. The question is why we are not doing it. And the list I have is budgetary restriction. People don't put money where their mouth is. And we are reactive and not proactive. And we are having difficulty in sharing power and visibility. And interventions are not aligned with long-term national goals and program, including Vision 2030. And we are into a lot of meetings, a lot of chronic contemplation rather than praxis. And we don't have confidence in sustained support across election cycles. And although we can get people gather around common goals, but a lot of hidden agendas come in the way. And I have my job description and workload. I have to get special permission to come here, and I cannot get it very often. And although we agree on collaboration when it comes to task shifting and task sharing, we want to do it together, but don't give me more work, I have enough. And the issue about competition versus collaboration. Everybody has their silos, their, So I want to get some advice, what in your work, working with different agencies and ministries, have found works to break the barriers for multi-sectoral collaboration.
We will have to answer very shortly on that because our time is up. So thank you for those questions. Would you like to say something briefly?
It's basically the importance of planning and the importance of using data in planning. But I think it's also important to know that even though we all want change, we're all afraid of change. So getting governments to change, as they do in this area, is not that easy.
Thank you. And we thank our presenters this morning. I'm sure this is going to stimulate our talk over lunch, so we can probably get together and talk some more about this. And hopefully, by the end of the day, we will come up with some new strategies that we, sitting in this room, can now begin to think about embarking on, how now, and what, and who is involved now, who are we going to pull together with, It's probably going to also depend a lot on civil society, which is where I think we also need to be going, because this calls also for advocacy. All right, thank you. Thank you, presenters, and thank you all for sitting and listening so patiently.